Gilbert the hamster is wheezing and coughing. He has a condition known as cystic fibrosis.
What's wrong, Gilbert? Are you sick?
Oh, hi there. I was diagnosed with cystic fibrosis when I was much younger.
I've never heard of it. What is cystic fibrosis?
Cystic fibrosis is a multi-organ disease which mainly affects the lungs and digestive system. Patients have frequent hospital visits to monitor their condition. I'm going for a checkup soon. I'll tell you all about it later. Gilbert arrives at the hospital for his first X-ray scan. He enters the reception and meets Mr. Chips the fish, who is also waiting for a scan.
Hi, Gilbert. I see you're booked in for your first X-ray today. Have a seat, and the radiographer will call you soon.
Hey, Gilbert. Are you nervous?
A little, to be honest. I've never had an X-ray before.
Don't worry. I've had loads, and it's not scary at all. X-rays are one of the most common imaging techniques used around the world in screening cystic fibrosis. It will be painless and quick.
Are you having one too today?
No. Today I'm going to do a CT scan instead. I had to drink this special drink called contrast so they could see my lungs better.
Mr. Chips, your radiographer will meet you for your CT scan now. And Gilbert, the radiographer is ready to meet you. Follow me, please.
Nice to meet you, Gilbert. Now, as part of infection control, could I ask you to please disinfect your hands before you enter the X-ray room? As you are aware, having cystic fibrosis means that you are more at risk to picking up infections, which is why we have sterilised the room and equipment.
Okay, I'll wash my hands.
I know this is your first X-ray, but there's no need to worry. It will be really quick and pain-free.
X-ray procedures are really fast. Normally, they take around 15 minutes, including the time it takes to change into the gown and get positioned for the scan.
Gilbert, could you take off your watch and any other metal objects you have on before we start, please? We would also like you to wear this vest to keep you safe and protect you from any radiation. I'm also going to ask you to hold your breath and keep as still as possible, just like you do when you were sleeping. I'm going to leave the room now to start your imaging, but don't worry, I'm still watching. Stay in your position and it will be over before you know it.
The radiographer will leave the room to start your imaging procedure. Gilbert has been given a gown and was asked to remove his clothing and any other metal items. This is to ensure nothing will interfere with the imaging quality.
That's great, Gilbert. We're all done now for today.
Hey, how did your scan go?
It went fine, actually. How about you?
I just finished my CT scan. It's really similar to an X-ray, but it can produce a 3D image rather than a 2D image an X-ray makes. The machine is large and looks like a donut.
CT scans are really useful for treating cystic fibrosis because they can show radiologists a really detailed image of the inside of the lungs. They can then figure out how severe the disease is by looking at the buildup of a sticky substance called mucus in the lungs.
We might book you in for a CT scan too, Gilbert. It's completely painless, just like an X-ray, and they can really help us in treating cystic fibrosis.
I heard you mention an MRI scan too. What is that?
Yes. MRIs are commonly used for patients with cystic fibrosis. Unlike X-rays and CT scans, MRI imaging uses a powerful magnet to create a really detailed picture of your lungs. We can even look at the lungs in real time using MRI.
Wow, does the machine look the same?
It's just like a really big tunnel. I know it sounds scary, but it really isn't. We even have a little TV that you can watch while we take the scan, or you can listen to music if the noise of the machine is too loud. I sit in a different room, but I can talk to you the whole time through the intercom in the machine.
It's over in no time.
So which is better, MRI or CT?
Well, CT is more commonly used for cystic fibrosis, but MRI can be helpful too to examine lung function and the damage to your lungs. After we've looked at all your images, we can help you to get better.
The pictures won't really make sense, but your doctor knows just what to look for and can help you with your treatment.
All patients with cystic fibrosis should exercise often, do breathing exercise, and even cough on purpose.
Coughing on purpose?
Yeah, there are also special accessories like therapy vests, which helps in clearing the airways. Taking supplements is also important to digest food well. Make sure to drink a lot of milk and get lots of vitamin D.